You don't just catch candidiasis. This is because the yeast is already there. Hello guys, welcome back to my YouTube channel. Thank you so much for stopping by, guys. I really appreciate you. And if you're new to this channel, I am Grace and I am so excited to welcome you to today's video as well as to my channel. Please do well to subscribe before leaving, hit that like button and click the bell notification icon so that I get all notification. So in today's video I'll be talking about candidiasis. Candidiasis is also known as thrush or moniliasis. It's a fungal infection caused by a yeast known as Candida albicans. Candida albicans make a quiet home of itself on the skin, the mouth, the gastrointestinal tract, and in the case of women, the vagina, without bothering anyone. This makes it a normal flora. But occasionally, this organism can grow out of control, causing pain and inflammation to the various areas which it is found. And two, this infection can also lead to death when it gets to bloodstream as well as vital organs such as the heart. This makes it a constant nuisance. You don't just catch candidiasis. This is because the yeast is already there. Although there are several factors that can increase the chance of the yeast going out of control. The common one being the overuse of antibiotics. Yes, yeast must compete for the right to live on your body with other organisms, the common one being bacteria. And most bacteria that live on the intestine, the mouth, the skin, as well as the vaginal tract are harmless, and also they fight against this yeast. When you take antibiotics to deal with the less friendly one, you can as well affect the ones that are harmless, thereby leaving a vacant in these areas. And at the end of the day, the yeast occupy this area that you've already killed the harmless bacteria which fights against them. And antibiotics are not active against this yeast, so they start to grow and multiply. Steroid and cancer medication weakens the immune system, and this can allow yeast to flourish. Also, Candida albicans infection of the mouth, also known as oral thrush, is mostly common in people that has infection already, like people suffering from HIV and AIDS, and diabetes patients as well as cancer patients. Then taking birth control can also increase your chance of getting vaginal candidiasis. Hot weather, poor hygiene, and tight clothing are also risk factors as they create the ideal environment for this yeast to flourish. Other factors that can increase the chance of getting candidiasis is obesity and pregnancy. Generally, yeast thrive in intragenous area, that is area where skin contacts skin. Overweight people have folded areas on their skin, and they also sweat. This creates the moisture environment that yeast actually needs to flourish. Then in pregnancy, during pregnancy, the estrogen level becomes high, and this increase in estrogen level is a risk factor for yeast to flourish. In rare cases, candidiasis can be sexually transmitted. Candida infection of the skin may appear as a clear patches of red and itching on the skin, often with leaking of fluid. There's scab around the rash area, and it is most commonly found on the folds of the buttocks, the in between the breasts, as well as the fingernails, Then it can also be found on the navel, but most often it is not pronounced in people with dark skin. Vaginal candidiasis may result in a thick white clumsy substances with minimal or no odor, and then inching and burn may be experienced during urination as well as sexual intercourse. Oral thrush may cause cord-like patches on the mouth, the tongue, and around the lips, and sometimes it may cause red crack on the lips. Candida infection of the penis are rare, but it may cause the tips to be red, swollen, and as well painful. If you experience these symptoms I just mentioned, it is advisable you go see your doctor to prescribe antifungal drugs for you. Then there are other preventive measures that you can take. Ensure that after going to the restroom, you wipe yourself from the front to the back, then because the renal contain a lot of yeast. Avoid using soap on the vagina, as they kill the harmless bacteria that help you prevent yeast from overgrowing. Then reduce the use of antibiotics. Don't just, when you have cold or flu, you shouldn't just go and get antibiotics, because cold and flu is not caused by bacteria, and it's not every time you just go because you are feeling sick, you just go and get antibiotics and start taking. Then the thing is also for you to know the kind of birth control that you are taking. Talk to your doctor about your birth control, please, to maybe probably change it if you start experiencing yeast infection after taking certain birth control pills. Then ensure that you wear loose clothes, not always tight clothes, but tight clothes can create an enabling environment for the yeast to thrive. So ensure that you wear loose clothes. To avoid reinfection, ensure that you discard your underwear that you used during the infection, or if you don't want to discard it, you can boil it in hot water. Thank you very much for watching this video. Thank you so much, I really appreciate. Please do well to subscribe, hit that like button, and please comment, tell me what you think about this video. Until my next video, bye, and please stay safe.